Welcome, everybody. Welcome, everyone who is joining us today. Excited to see everyone. We've got a wonderful webinar today about hospital safety and hearing loss. My name is Melissa Cruz, and I am with HLAA, and I will be doing a quick introduction before I turn the webinar over to our panelists and moderator. Going to give it just a couple more minutes as folks are I can see folks joining. We're really glad to have everyone here with us. As I said, my name is Melissa Cruz, and I'm the Chapter Engagement Manager for HLAA. I'm going to start off today's webinar by giving you some quick tech tips about the webinar and joining. The first one is to see captions, and we do have a live captioner. You're going to need to click the CC icon and click Show Subtitles. If you would like to increase the font size, you're going to click on the font size in the subtitle settings. We would like for the participants to use the Q&A box to ask questions. We'll be using this to facilitate questions after the presentations. We ask that folks just leave the chat for any sort of technical issues or for the panelists to talk amongst themselves if needed. If you've joined by computer, your presentation should be in the side-by-side mode. There should be a shared screen with the presentation on the left, and the speakers will appear on the right in a gallery view. You can adjust the size of your side-by-side view by hovering your pointer between the shared screens and panelist views, and click on the gray line and slide to adjust your to your desired view. If you've joined by a mobile device or phone, your view may be slightly different, and you may have to scroll between screens to get to your desired view. Just a quick disclaimer that HLAA does not endorse any product featured in this webinar. HLAA is providing educational opportunities to learn about new products and opportunities and how they can benefit people with hearing loss. And now I'm going to be turning the presentation over to our moderator and HLAA board member, Elaine McCaffrey. Elaine?
Yes, thank you. Okay. Well, shall I start?
Yes, absolutely. Go ahead and start.
All I can see is you on my screen.
I can see everybody else.
Maybe I have this set wrong. I'm sorry. All right, that's better. Okay, welcome everyone to the 2025 Hospital Safety and Hearing Loss Panel Discussion. My name is Elaine McCaffrey. I'm a member of the HLAA Board of Directors. I'm also one of 4 on the strategic team for the HLAA Communication Access and Healthcare Program. Thank you, Melissa, for representing HLAA as our moderator and representing HLAA for hosting this meeting. And thank you to our captioner, Joe Gale, and thank you to our 2 sign language interpreters. So for the history of this program.
Elaine, can I interrupt for 1 second? Folks are asking if you could speak up just a little bit.
Okay, maybe get closer. The history of this program is the HLAA Chicago North Shore chapter hosted its first hospital safety for people with hearing loss program in 2015. 4 Chicago area hospital representatives sat on a panel at our chapter meeting to tell our audience about what accommodations their hospitals had for people with hearing loss. They all proudly presented their ASL, their American Sign Language interpreters, and therefore this was an awakening to everyone because all they didn't have anything for people with hearing loss. They only told us about American Sign Language interpreters. And this awakening, well, what happened as a result was our chapter hosted an annual hospital safety for hearing loss program from 2016 to 2022 because hearing loss still remains invisible. The goal to bringing awareness, our goal for this program today and has been all along is to bring awareness to people with hearing loss. So I will start out here with one of the questions that was in registration, and that was, what have I learned since 2016? It's simple. Bring awareness to hearing loss needs constant attention. So how do we go about doing this? We need to plan ahead. And when I say we, I mean us, the people with hearing loss. How do you plan ahead? Well, when you're in the hospital, let's say you're in there for a doctor's appointment or an MRI, this is before you are having any stay in the hospital. You've got your feet in the ground, you are a patient in that hospital, and you can walk over to the information desk and you can ask, who do I talk to where I can get accommodations for my hearing loss? And that is the beginning of finding the right person within that hospital. What else to plan ahead? A number of these chapters, or several of them at least, have created a hospital bag or a to-go bag. They have done something for their members. In our chapter, we tried to create our own hospital bag for the emergency of having in there the things that you need to take if you have an emergency and you go into the hospital. Along with plan ahead, people don't ask for what they need. I call this self-advocacy, but in talking with people, I've learned that they cannot explain what they need. And that's been part of we call it a barrier, we've been calling it stigma. But I really think that a lot of people just don't know how to ask. So I will tell you that what I do, when I'm in a situation, whether it's medical or whether it's just every day, I will say to people, I have hearing loss. I have trouble understanding. Please help me. Speak low and slow and face me. Now, for those of my friends whose hearing is different than mine and they need speech to text, I listen to them. They say, I depend on speech to text. So here's my smartphone. Let's look at this because this is how you can help me hear. And of course, in medical settings, if you're going in advance, you have to order CART. So that doesn't quite apply in these simple situations. What else have I learned? Never assume that the medical facility has accommodations for patients with hearing loss. And again, this is all part of be prepared. I learned that accommodations for patients with hearing loss varies at each hospital, and it varies in each and every department within that hospital. So again, you can't look for the similarities. I have people say to me, they're supposed to know what to do. They're supposed to do this. It's not true. You've got to be able to tell people what you need. Again, my personal experience now in the Chicago area is that COVID changed a lot in a positive way. Medical staff is more responsive when I tell them I have hearing loss. And perhaps I've become a better advocate. So to let you know, going forward, this program has 5 segments. Teaching tools and strategies for self-advocacy will be next. After that, 2 stories will be told by members of our audience. Then the panelist discussion will happen. And after the panelist discussion, the questions that the audience submitted at registration will be asked by Melissa, and the panelists will be able to answer these questions and have conversations between the panelists. And lastly will be final remarks by the panelist. So let me dig right in here to self-advocacy in all medical settings is crucial. Now, when you registered, there were links for 5 different handouts. These handouts are important for you to read. There is the Communication Access in Healthcare Form, or which is called the CAP. There is the HLAA Guide for Communication in Healthcare for Patients, the Guide for Communication in Healthcare for Providers. There is a 1-page sheet on how to advocate for yourself in hospital and medical settings. And there's an article in the Hearing Life magazine, Spring 2025 edition. Each one of these handouts is important for you to have. That's the backbone of what my presentation is about. So communication, or the CAP form, is a communication access plan, is a 1-page form to let the doctors and healthcare team know about your hearing status and the communication aids and services that you need. So bring a copy of the CAP form to your appointments. And I mean to your doctor, when you're getting an x-ray, when you're seeing the dentist, whenever you're seeing someone and you need to get communication services, give them the CAP form. That's one way that you can almost avoid by telling them what you need, but I never want to avoid also you expressing that. And review that CAP form with your doctor and healthcare team to be sure that those services are that they understand what services you need. Now, I saw questions in the registration about what to do in emergency situations. I really direct your attention to the Guide for Effective Communication for Patients. Read it. I'll pay 1 page in there, but it'll give you information you need for the emergency room. It gives you the information that you would need when you're getting an MRI or you're in those situations where you surrender your hearing devices. The guide is something that you need to read as a patient. And the Guide for Effective Communication for Providers, this is given to the panelists every year. I've given this to my doctor. You give it to your doctor. You give it to anyone that you want in the medical profession to use. And I will go back and say that the CAP form, by the way, has been adopted by different hospitals across the country in the way that they have used it. So you can spread these great ideas around and teach others. The how to advocate for yourself in the hospital and medical settings, you'll be familiar with that because it starts out whenever you're asked your name and your date of birth. You tell them your name, your date of birth, and tell them, I have hearing loss. Please help me. I need. And along also on that, how to advocate is all these different pieces that you need to bring and plan ahead. So by all means, please read this and keep a copy of it around. And I want to draw your attention again to the Spring 2025 Hearing Life magazine. As the article my daughter and I co-authored, My Journey from Caregiver to Patient to Advocate. It is an educational tool for you to teach you and your family how to help you in medical situations. I had someone contact me right after this came out. He said, I brought that article home, Elaine, and we sat at the kitchen table and we discussed it. So be sure to note in that article on page 13, there's a 3x5 sign that's in the corner on page 13 that didn't get to be properly labeled. This is a badge holder, and this was clipped to my pillow when I was in the hospital on the side where everybody walked in. And this was what they saw when they first walked in. So I did a survey just in the morning, one of the mornings, and asked them what was the best thing I did to draw their attention to my hearing loss. Every single person, whether they were drawing blood or whether they're taking my temperature, the nurses all pointed to this sign. So it was a good tool. So let me move on to just one quick subject here, which is very sensitive and a very big issue. And I'll just weigh in slightly because this is also in the questions. Speech to text apps, which they are not HIPAA approved. But these are like when you're using Otter AI on your Apple phone or Google Live Transcribe on your Android phone. These are the speech to text apps that many of my friends depend upon. If there's an objection, you have the right to waive your HIPAA rights. In most cases, if you just explain why you need the use of this phone, the doctor or person you're talking with will definitely consent, usually. But from my understanding and talking to other attorneys, the attorneys in the apps in smartphones are not programmed to translate medical words. The doctor has the right to object to the use of speech-to-text apps because this exposes him to liability, him or her, excuse me. So when you know you're going in for a hospital stay, there's no reason that you should be asking for CART, and you do this ahead of time, no less than 24 hours or when you make your appointment. You let your doctor know and you let the hospital know that you need a CART provider ahead of time. So I'm going to pass this along now to the two people that are telling their stories, and step back and thank you again to Tim Penny and Christy Abrams for doing this.
Thank you so much, Elaine. I'm going to try to really speak clearly and slowly, and I'm hoping that my audio is okay. Just pulling up but I'd like to say good morning to everyone. My name is Christy Abrams, and I'm the hard of hearing specialist with the Arizona Commission for the Deaf and the Hard of Hearing. And I've been navigating hearing loss since the age of 6 years old. And I grew up with hearing aids, but just over a year ago, I became bimodal, and I now have one cochlear implant and one hearing aid. So, and I'm inserting here too, just to remind people, only about 1 in 5 people who need hearing aids have them, and fewer than 1 in 20 who would benefit from a cochlear implant has one. So navigating healthcare when we're hard of hearing is challenging. And I hope by telling my story, I will highlight some of the barriers that we face in the process of any healthcare visit. The one story that really sticks with me is being a hard of hearing mom and taking my early teenage hearing daughter to an ER late one night. She needed to go to the emergency room. She was in pain, and we found out later on that she had an ovarian cyst. So I want to set the stage because just the car ride to the ER, the emotional impact started rolling. The car is difficult for us to understand because it's dark, we're tired, I'm forward facing, so I was trying to listen to what she was experiencing. So I was already overwhelmed with the thought of going to the hospital and navigating the emergency room. From the moment the hospital doors opened, I knew that I was going to have to put on my best teaching hat, because often people don't realize it's not enough to say, I don't hear well, or I'm hard of hearing, or I'm deaf. People use different words, but even healthcare professionals don't always know what to do next when we share that. Like Elaine said, we really need to give more details. So when we approached the registration area, I let them know, due to the plexiglass and the fact that you're wearing a mask, I'm not going to be able to understand what you're saying because I'm hard of hearing. Could you please pull down your mask? And they did so right away. Then I let them know, could you please let me know what door they're going to be coming out when they call us back for our appointment? Because we were then heading over to a large waiting area that's filled with families and children, and it was loud. And I was worried I would miss being called back. So when the person did come out to summon us, I again let the next person know, because we go from person to person in healthcare visits. So I let the next person know, I'm hard of hearing, please pull your mask down so that I could understand you. And they were, sure, no problem. And then she proceeded to turn around and walk down the hallway to our examination room, asking us questions and talking. So then I had to explain, so when I'm behind you and when you're not facing me, I'm not able to understand. So even though she had pulled her mask down, I still had to be specific and say, I need 100% face-to-face communication. And she said, I'm sorry, I didn't even think of that. Healthcare professionals, as you know, you're multitasking and you're busy. So we just need to give you more details. We need to be a teacher. At one point, the next nurse that came in, I let them know again, please pull your mask down. I'm hard of hearing. It's really important for me to have access to the visit. And the nurse turned to me and she said, that's okay. And she turned away. She said, I'll just talk with your daughter. So that felt a little dismissive, and I felt a little inadequate, but I just stayed positive and I said, but I'm the mom, so I need to be part of the communication circle. And you really do, you need to speak directly to the hard of hearing person or their family members that are there to support them. It's easy for us to get uncomfortable and want to just speak with someone that can hear well. We need to do what we can to make that communication happen. Then in this ER visit, my daughter needed an ultrasound. So the ultrasound technician came into the room and they turned all the lights off. And the lights had to be off so that they could see the screen. So I just let them know. And again, I remain positive and I just said, I'm hard of hearing and it's dark, so I'm not going to be able to understand what you're saying. So at that point in time, they did let me use the captioning app that Elaine mentioned. And I was able to do really well with that. It was dark. I explained what app I was using. I wasn't recording anything, but it did help me follow along in the conversation and be part of the process. So often people have shared with me, it seems like these things are common sense, but they honestly didn't even realize how their actions impacted communication. So again, in an emergency situation like this, I didn't have an opportunity to plan ahead and request cart captioning like we have here today in the meeting. And things like that are so important, but sometimes we just have to do the best we can. And I hope that this will help you understand how small changes all along the way can help to remove barriers and make healthcare environments more accessible. I'll go ahead and pass it over to Tim.
Thank you. My name is Tim Penning, and I'm a retired former healthcare worker. I worked in healthcare hospitals for 42 years and IT predominantly. My story isn't as emergent as the one Christy had, but basically just showed that there's a need for hearing recognition in healthcare. Set the stage for this. I took my wife to an outpatient surgical appointment. And in the surgical waiting area, they had one desk with a big plexiglass sign, everybody behind it wearing opaque masks. And they had single seating along in front of the desk for about 200 feet. And so you would get a whatever seat that you could. And when they had any updates about the patient, they would simply yell the name of the patient. And perhaps you would hear it. More likely you wouldn't understand it. I have a severe hearing loss, and so I understood nothing that was said. And every time a name was mentioned, I would walk to the desk and say, who did you call for? And then go back and find my seat and rinse and repeat. I mean, it just happened all the time. And this was about a year ago, so this was pretty much post-COVID. And so I contacted the hospital where I had worked, and that was where we were, and just said, I've seen at other hospitals where they have a status board that will show the patient initials, who the physician is, and give you the status update on what's happening with that patient. And so I suggested, having seen that at a sister hospital in Atlanta, I suggested that they go ahead and just copy that code that was in use at the other hospital and implement it at their facility so that people who need to get these announcements, who can't really hear and decipher because there's a TV blaring over here and people are talking and whatever, that it would just make it better communication for patients. Their response to me was simply they took the plexiglass down. I went back just recently to see if anything had changed, and the plexiglass was down, but they still simply yell from behind the desk. And I don't think that they were being obstinate about it. It's just that there's a real lack of advocacy in healthcare settings, especially down here in the South. And there's no one who's been able to bring that forward to where it translates into easily at hand solutions that can make effective communication simple and available to everybody, not just people who have hearing difficulty.
Well, thank you, Tim, and thank you, Christy, for your telling your story. It's really appreciated. I'm going to move on here to the next step and get to the panel discussion. We are fortunate to have hospital personnel who have offered to sit on this HLAA panel. These panelists are exceptional. They want to help their hospital and other hospital personnel develop and improve the accommodations needed for effective communication for the hearing loss community. I want to thank you, panelists, for being here today. Each speaker has received a list of questions, which are issues most important to our members, to be used as their guide for this presentation. They will each have 9 minutes or so to present, and conversations between the panelists are welcomed. So let's start out. It's with Carlos, and I'm going to let you each identify yourself and tell your position. So I'm going to go off the screen. Thank you.
Thank you. My name is Carlos Olvera. I manage the interpreter services at Rush University Medical Center. I'm also the co-chair of the ADA task force here at Rush. Rush University Medical Center is located west of Chicago. It's in the city of Chicago, but we're a system with 3 hospitals, one in the western suburbs in Oak Park and another one a little bit further west in Aurora, Illinois, which is Rush Copley. And we have, I want to say 5 or 6 subspecialty, I call it like almost mini hospital with the outpatient services, multi-specialty offices, and pretty much cover our Chicago metro area. And as mentioned, usually, any assistive device or anything that to do with hearing loss. I forgot to mention, sorry, I'm actually also suffer from hearing loss. I wear bilateral hearing aids, which I didn't know I had hearing loss until everybody covered their mouth. I realized that I couldn't hear or understand people. And I know we received some questions. Wendy, would you like to introduce yourself? Is there the other panelists?
Sure. My name is Wendy Martell, and I am the program manager of Magnet and Nursing Excellence here at Swedish Hospital. I do have a PowerPoint presentation as well. Do you want me to share, or do you want to keep talking, Carlos?
If you'd like to share it, I don't have a this is Carlos. I don't have a PowerPoint presentation. I was just gonna do a conversation. Wendy, feel free.
Perfect. Okay, I will take it away. Let me just start here. And Melissa, hopefully you can confirm you can see my PowerPoint.
Yes, we can.
Okay, great. So as I mentioned, I am the program manager of Magnet in Nursing Excellence. So welcome to Swedish Hospital. I'm just going to briefly tell you that I am part of Endeavor Health Swedish Hospital. So we are 9 hospitals within our system. And if you haven't heard of Swedish, it was founded in 1886. We are in Chicago's Lincoln Square neighborhood, and we do serve a very diverse community here. We have advanced care with over 50 specialties, extensive wellness programs. So this is where we are located. We also host Chicago's only certified medical fitness center, and we are a leader in health equity initiatives. Now, one of the reasons why I love to do this presentation is because it really holds true with our mission, vision, and values. And when I think about values, the one thing that I think is respect for everyone. And so we really want to think about championing diversity, equity, and inclusion for all through mutual respect. So by being able to provide services for our patients who are hard of hearing, that is definitely one way that we want to be respectful of everybody and inclusive of the care that we provide. One of the hardest things is finding out, where do you go to either schedule your interpreter and communication services, or who do I contact? So I really wanted to make this easy for everybody. And by nature, I am an educator, so I do like to show a lot of pictures and where you find things. So when you go to the Endeavor Health website, and if you click on the little magnifying glass, you can type in interpreter, and interpreter and communication services will pop up for you. And what I did is I took a little snippet of what that looks like. And so you can see on the left here how we support your communication. So we do offer in-person interpretation, over the phone interpretation. So that's through our language line. We offer video remote interpretation, which is similar to the language line, except it's think of an iPad on wheels. And when we hit a button, an interpreter will pop up for you. So if you need American Sign Language, for example, we can get that immediately 24/7. And we also offer TTY and TTV devices. And then on the right-hand side, it just shows accessing interpreter and communication services and how you would schedule that. Now, in terms of our questions, I'll briefly go through these, but we do offer annual education for all our staff on interpreter and accommodations. And we do this through yearly education, and we offer it throughout our orientation for new staff. We always screen all patients at registration so that we can make sure that we are identifying our patients that need the extra support. Now, for our assistive tools and devices, I took this from our website, but I wanted it to be clear so that you can read along. So we do have our sign language interpreters, the OPI, which is the over-the-phone interpretation, the video remote, the TTY, the TTV. But what I didn't mention was the CART services. And Elaine mentioned this earlier. And what that is our real-time captioning that's available for patients who need this service. Additionally, we do offer other tools such as tablets, whiteboards, written aids based on individual needs. And I did put a little screenshot of those here in case you're not familiar with what these items are. In terms of calling ahead, you would want to call, I would recommend 36 hours in advance. But keep in mind that when we are using our video interpretation, that is readily available. But if you are requiring some type of surgery or something that might be a little more extensive, that's when we ask you to coordinate that and work with your doctor's office so that we can provide those accommodations to you. In terms of troubleshooting all
Wendy?
our devices, yeah.
I think your notes are showing, and it's apparently making the screen a little small, the PowerPoint a little small for people.
Sure.
If you can turn off your notes, that will, I think, make the screen.
How about that? Is
Yes.
this better?
Yes.
Okay. Apologies. Thank you for letting me know. In terms of troubleshooting our devices, our staff here is really great. We actually work very well with our vendors. So when we have issues, we are able to quickly correct anything that's wrong with our technology. But so far, we haven't had those issues. As I mentioned earlier, you can always arrange, for example, if you would like to have somebody with you, maybe a hearing advocate, perhaps you're coming in pre-op for surgery, making sure that you are arranging that with your healthcare provider or with our nurses so that we know what necessary devices you will need. This is going to best help us to support your needs. So definitely being proactive. For our registration staff is excellent. They will ensure that we have taken into account what exactly it is that you're requiring. Are you hard of hearing, or is it that you're deaf? Do you need some type of translation? And for our emergency room, I have reached out to our managers there, and they were very clear that they will work with all our staff. They will write down key details. They will make sure that they're providing you with a copy of the face sheet, which clearly highlights all the sections that you also need to complete and fill out. For our emergency staff, again, they always have iPads with video remote interpreter access. So there should be no concern that we will be able to accommodate you very quickly and without delay. And I wanted to show a visual here of what we do. We will put up, if we know that our patients are hearing impaired, and with the permission of the patient, if they would like us to put a sign, we will put a sign so that everybody who encounters this patient will know to speak louder, to speak slowly, and so it's visible from staff to staff. I also wanted to show, so this was mentioned earlier, this is a screenshot of, we use an electronic medical record, and ours is Epic, which is what's commonly used. But within Epic, we can chart your hearing disability and what type of assistance you will need or that you're requiring. And on the right, I know this picture is a little bit blurry, but this is our version of a status board. So on the right-hand side, you can see if the patient speaks a certain language, it will tell us. And so that anybody who's opening this chart, we are aware that you will need some live interpretation, or do you have hearing aids? And I encourage everybody that if you do not have this within your chart, please advocate and ask for the staff to put this in. Most hospitals can definitely do this with you, even if they're not Endeavor Health. In terms of sharing information, we do make sure that we are communicating this back and forth with with everybody that we're encountering, whether you go here or you're transported. And then lastly, we do make sure that if you're bringing hearing aids or cochlear implants, that we are labeling them in a safe storage, such as a denture cup. But this is something that we will use. And I presented this to my nurses this morning, and my nurses also reminded me, they said that when I speak to you, to also remember to bring your batteries for your hearing aids and making sure that those are charged and that they're readily available so that we're ready to use it for the next day. So thank you for listening to me. That is what I have to share that we are doing at Endeavor Health. And I will pass it on to the next panelist. Thank you, Elaine.
Just trying to get myself back here on the view gallery. Okay, Patty, do you want to go next?
Absolutely, I would be happy to. I'm going to share a screen. I do not have as many pictures as our previous panelists, but I still have some great information to share.
Thank you.
Is everyone able to see my screen?
Not yet.
There we go.
Yes, now I can.
Fantastic. So I'm Patty McMahill. I'm the Director of Clinical Integration here at OSF Healthcare. OSF Healthcare is an integrated system here in Illinois. We are based out of Peoria, but we have multiple locations across Illinois and Michigan. We cover the gambit from similar to Carlos and Wendy. We have multiple medical centers, then we have medical group locations, we have home health. We also have some digital innovation throughout our system. This just gives you a quick overview of our geography. We have 17 medical centers across the state of Illinois. We have one in Michigan. We have 171 locations. So that is the medical groups and the medical centers. We have over 900 practicing providers, advanced practice providers. We have over 1,000 employed physicians. We're getting close to 26,000 employees. We refer to our employees as mission partners. We are a faith-based organization. So again, don't want to go into a ton of the details with this, but you can just see that we are a large system and that we cover a lot of area for the state of Illinois. So within that, assistive services is an overarching term that covers the not only disability resources, but then language services across our system. So I'll go into some more details, but what we provide, we have video remote, very similar to what Wendy was talking about. We have integrated tablets across our system. We utilize MyChart. We are an Epic system, so we have MyChart at the bedside, and many of these applications are located on those devices. We utilize telephone interpretation. We utilize in-person interpreters across our system. For our disability resources, we are in the process, and I'll explain a little bit further in our slides. We have an effective communication kit that we're deploying across our system that has hearing amplifiers, magnifiers, and communication boards in it. We ensure that we have medically accessible equipment at our different locations for persons with disabilities. And we work, we're reviewing all of the different formats. So do we need to provide some of our forms in an audio format, in a different video format for our different patients and their resources across our system? And then we do document translation for all of our patient-facing materials and many of our consent forms. So I'm answering the questions throughout, but our education and training. So we have annual online modules that cover two different areas. We talk about disabilities and understanding the services and how we have those communication with our patients and families. And then we have a separate module specific to language services of themselves. We do just-in-time training. So within my area, we have resources that go out on a particular cadence to our different areas and make sure that we meet our staff at their service area to then really walk them through. A lot of times it's familiarity. So many times we may have a patient who comes in that speaks a particular language or is hard of hearing, and there may be an extensive period of time before that particular location sees another patient or family member that has that particular need. We like to keep it front of mind. Again, we develop that muscle memory so that we're very attuned to the needs. Our focus has been less on a lot of the very innovative tools, but developing a culture within our system to really recognize and have the dialogue. That's really, I think, the most critical part of this, is to feel that comfort level and have that dialogue with our patients to understand what's the best way to communicate with them. With that, we've developed an assistive services work group across our system. So we have key members from representatives from each of our hospitals, different regions for our clinics and locations that meet on a monthly basis to discuss scenarios and potential gaps in our education and services that they're aware of as we grow. So within our resources and technology, we've just recently developed these communication kits. So within that, there's a hearing amplifier, multiple disposable headphones. There's multiple size of magnifiers. We have a signature guide for some of our resources. We have a whiteboard, clear mask, and then a picture board. So we worked with our language provider to develop a dual language communication board, so it's available in Spanish and English. We have interpreter iPads across our system, and within the applications on those, we have text-to-speech. And we also have a P3 video relay application on all of the devices that are within our medical centers. And so then too, we have the clear mask pen and paper. The majority of our funding for some of our communication kits and some of these other auxiliary aids come from donations. We have some very fortunate foundation and donating resources that are very attuned to persons with disabilities and really have heartstrings for that. So we're fortunate with that. And then many of our clinical locations then just know the need, and that funding comes from their local resources. So I'm just going to walk you through what a little bit of this looks like. See that journey of a patient and where we ask those critical questions and how we mitigate it. So at that first point of contact, we ask all of our patients, do you either have a language need or a disability, or does your companion with you today or that will be joining you have a disability or a language need? And from there, then we ask if there are particular assistive needs that we can provide for them throughout their continuum of care. We ensure that we document that within their medical record. And that way, similar to what Wendy was talking about, then there is a visual cue that makes it aware to our staff as they go through those different, continuum of care locations. So I go from registration to now x-ray to then I come back out to different areas, and we have then visibility of those needs. Assistive services, my program is really serving as that center of expertise to answer questions not only from our patients and our families, but then our internal mission partners to then really guide them through what are the best resources to help provide that effective communication. And then we ensure that we're documenting that those services were rendered for our mission or for our patients and families. Some specific examples, I'll share a quick one. We had a patient arrive for a surgery and was concerned about losing their hearing aids while they were sedated. So we have a policy throughout our system about patient belongings. And so assistive hearing devices and other resources, potentially dentures and other personal assistive devices. What the kit looks like is different across some of our systems, but some of them are a cup similar to what Wendy showed, and others are a larger kind of, I don't know how to describe it, but it's a rectangular form that has multiple sections for it. It's rather large and it's a bit cumbersome, but it really sticks out so that then things don't accidentally get thrown away on a food tray, etc. So it was purposefully made larger so that it is front of mind for our staff to ensure that none of those belongings are lost for that patient. And some are then also stored with security and other resources. So we were able to secure and that those devices for that particular patient. And then that patient felt so much more comfortable. They knew that they didn't have to worry about it. And because of that, they were clearly communicated to, and then they had less anxiety of losing their resources that they had. So we're always looking ahead. We are humble that this is a continuous education. We're continually improving. We do not have everything exactly right. And the feedback that we receive from patients and others throughout everyday interactions really helps us get better at what we're doing. So the communication kits has been a huge part of our growth. We've also learned over the past 10 years how to better document these accommodations and how we can address these with patients to then really keep our mission partners focused on effective communication. We know so much that effective communication really drives that journey for the patient and a lot of their outcomes, because if they understand what their treatment plan or some of these very complicated things are in a manner that they are able to really understand, that they do so much better with it. Ongoing staff education, like I said, we have yearly, but we have a regular cadence that we go and visit our locations. We're working with a lot of innovations. How do we utilize AI in a appropriate manner and really best serve our patients, but knowing that healthcare is complicated and that some of the verbiage is a little bit complicated for some of these applications in its current state. So we're also looking at better options that are HIPAA reliant for automated voice recognition, so that text to speech. But it's really key that we partner with our local agencies and resources to evaluate our services. So across the state of Illinois, we've reached out to the Center for Low Vision and Blind Resources to do focus groups to really understand some of the needs and the challenges. We've gone to a School of Deaf in Jacksonville, Illinois. We've partnered with non-affiliated hospitals to really understand what they're doing, and we joke that we call it the case methodology, but it's the copy and steal everything. You know, this is about the patient. This is not about just having this really cool thing that we keep to ourselves. And then we're part of the Disability Equity Collaborative, which is a nationwide group that looks at resources and advocacy for persons with disabilities. So really driving some of these larger companies like the medical record, electronic medical record services, to really ingrain this into their documentation so that we can really bridge those gaps with that communication. So this is just a summary slide. It just really talks about what you can expect from an OSF organization, and then you know, key things that we have done over the past 10 years. This has been a large growth for us, but know that we are providing our mission partners with education so that they really become more of a cultural steward, to make sure that we are not doing some of the things that were explained in Tim and the other stories, making sure that we have the right resources. There are a lot of technology advances out there, but we are not always, as a system this large, able to do those, but we can do the basic things right, and that's where we want to focus. And then really understand that we have a lot of gaps in where we transition the patient and the companions to other areas, and how do we really make that smooth so that you don't have to repeat multiple times, this is what my need is, I really need you to look at me, etc. So we really tell our staff to make sure that you ask the patient what is their preferred way to communicate. But we also need the patients to advocate for these types of resources. We can't learn until we are educated by you. So I just want to make sure that you understand that we do have a commitment across our system that with every patient, we can make sure that their effective communication makes them fully understood and to participate in their care. Thank you.
Well, thank you, Patty. I guess we can remove this, the PowerPoint, thank you, and bring this back up. Okay, so should we let Dr. Gala go first, or Carlos, would you like to continue?
Oh, I can just say just a little bit of thank you, Wendy and Patty. Pretty much that would have been the same presentation I would have put together. You will notice that a lot of the major medical centers or systems have very similar processes. And we have video, we have communication boards, we have put workflows in place. The other thing that I can talk about in Rush is that we're also looking at and give you an analogy of a restaurant, of back of the house employees. This year is the first year that Rush actually has put it part of the benefits is to cover hearing aids. And that's why this year I got my brand new hearing aids as part of my benefits. And we've discovered there's a lot of employees with hearing loss, and having employees with hearing loss tend to be, they're more empathetic, right, for patients, and also employees are patients of Rush. And that has helped bring awareness of people with hearing loss, and how to communicate effectively with them. Because if a coworker knows, like my team knows that I'm hard of hearing, in meetings and in other places, they know how to, talk to me, or again, slow and looking at me, that I have to look at them. They're going to put those practices out in the field too, out in the clinical areas. So it's important to institutions and systems not only to invest on the patient care of patients with hearing loss, but also for their employees. And the other thing is that when we are looking at things that would help patients with hearing loss, I always make the argument that it's not going to only help patients with hearing like myself, but also older patients. Closed captioning is not just for hearing loss. Nowadays, people are busy. Like right now, I'm sure some of you are looking at your phones and might have missed some stuff. Closed captions are great to have, because if you miss something, you have the text right there, and check if you miss something. So it's always great. We have a commitment now that all new constructions, all new registrations will have loop included in the registrations. We know we just had a major renovations of our areas, the fourth floor, one of our hospitals for registration is. And we put the loop system in there. We're not perfect, but again, it's important for patients to advocate for themselves too, and to not to stay quiet. And employees or healthcare providers are really, really busy, and they're doing 1,000 things at once. And we need to hear from you. So if you need to advocate yourself, like just how I do when I'm a patient and a different role. I notice, when I'm a patient, it's very different, and you feel vulnerable, and your mind, hearing aids are normal for me now, and it's going into surgery. They're my sensitive bank. So if they need to take them out, yeah, I'm going to be worried from the time that they're taking them out to, when we're doing the timeouts inside. That's happened. But with clear instructions beforehand with the team, it makes that very easy. It also, for the patient like myself, I'll be a lot smoother. So that's kind of my 2 cents. And I know I love participating in the panel because we learn from each other, all the MHS hospital, although we have very similar workflows and services. Each year, one of us might have a little bit something new. So it's, and I can want to assure everybody that hospitals and providers are here to help you, and we are listening. So please do let us know if you need help. So that's kind of my thank you so much.
Thank you, Carlos. Dr. Gal, would you like to please go ahead now?
Yes, thank you, Elaine. Hi all, wonderful presentations. Same as Carlos, I didn't do a PowerPoint, so I'm sorry. I just want to tell you a little bit about myself. I'm a pediatrician by training. So as a pediatrician, I always was trained to look for hearing problems in children. And because hearing is going hand to hand with learning. So one of the things I do as a medical interpreter, this is my job right now, is to look for those cues in the patients I'm interpreting for, if they are in need of special accommodations. Because sometimes people, they won't tell you because they feel embarrassed or for any reason that they need assistance. So I think that as part of my work as a medical interpreter is also to notice that and to notify the provider and to know that in the clinical record. I am an interpreter, a Spanish interpreter. I work with 9 other wonderful interpreters that are also in-house interpreter for Northwestern Hospital, Central Region. Northwestern campus is here in downtown in Chicago. And in Northwestern, we have what we call our LEP policy, which is Limited English Proficiency Policy, where we address the language needs of the patients, the families or companions, and when they need also special accommodations. That means that all our staff and providers are trained to assess the needs at the first point of contact of those patients with us, with the institution. That means it's going to be in registration as the intake in any hospital floor or when they go to any of our clinics. And what we do usually, the best practices is to explain about those services or to ask if the patient needs any special accommodation, to tell them that this is free of cost. And we try our best to provide those services within the 24 hours that the patients are in here. That means any language need, any special language, or ASL, ASL tactile, certified deaf interpretation card, and also, for example, special devices that the patient may need to communicate within their stay in the hospital. Also, all those special accommodations will be noted in the clinical record. They will be noted in different ways according to the different sections of the hospital, but they will all appear as in a flag in the clinical record. So everybody here, everybody any person from the staff or providers will be able to see those special accommodations. And once we give those special accommodations to the patient, they will also note it in the clinical record in EPIC. Something that we have also here in Northwestern is that patients by themselves, they can add those special accommodations by using my chart or in the website or the application. And those accommodations can be changed. I know that there was a question, what will the hospital do if those accommodations, special accommodations change? Well, they can be changed as many times as needed by the patient, or if they tell the provider, by the provider. There is also a special place in the patient clinical record where we can also note the special accommodations needed by the companion of the patient, which I think it's also very, very important, as one of us was talking first. You know, deaf parents, they need, the personnel needs to know that they need to speak to them, you know, facing them slowly, or if they need any other special device to be able to interact with the providers. About the resources we also have, well, ASL interpretation, certified deaf interpretation, ASL tactile, video visits, also using ASL interpreting. We have BRI interpretation with ASL available mostly for emergency cases or while we don't have the ASL interpreter ready or available at that time. We provide CART. All our TVs, they have closed captioning. We provide clear face mask, whiteboards. We have communication boards in different languages, as many languages as you can imagine we have them. We have also sound amplifiers and pocket talkers. And all those accommodations will be given to the patients upon request or if the provider notices that they need them. Most of the floors will have available pocket talkers. Our interpretation services also have them available and we can lend them if they don't have them. As a note, we used to lend them to everybody and we used to have a lot of them, but they were never coming back to us. So now we have only a few. So we prepare some instructions. So all floors of the hospital and clinics, we will send them that so they know how to request one and how to get one for their own services. And I've been interpreting everywhere in the hospital, and I can tell that most of the floors, they already have their own. So that is really, really great for the patients and also for us, the interpreters, when we go and try to interact with the patients. There was also another question about if patients need to call for requesting special accommodations and where to call. I will say that best practices for us in Northwestern is that you as a patient will communicate with your doctor, with your provider or the clinic, and then they will communicate with us to request those special accommodations. Could be ASL interpreting, CART interpreting, and CART services, sorry. We prefer to work in that way so we can make sure that we have as many details as possible about that appointment and that we are giving the patient the accommodation that they really need. And then also I would like to mention something about the hearing aids and surgery. I know that many of us said the same thing, but I've been noticing that when I go to interpret for my Spanish speaker patients, many of them, when they are in surgery, they don't have their hearing aids. So I will advise that I know that we say that don't bring any valuables to the hospital. Hearing aids are very expensive. I totally understand that. We know that. But you will be asked on the day of your intake for surgery, you will be asked a lot of questions and you will be able to hear, to answer. We have a system where all your belongings will be stored with your label, your own label, so they won't get lost. But it's a good practice for you to bring them when you are coming for surgery or for any other testing that you need. And I think that as an advice or a suggestion to patients, bring, as Elaine said before, bring your communication access plan with you, have them handy, ask about the accommodations if you were not asked when you arrived or when you're facing registration, and know your needs, know what you need, what you need to ask for, and ask your doctors and providers. We are here to help you. The same thing as Carlos said, we are here to help you, and we need to know how to help you communicate better, because communication when you are a patient is very, very important for your health, for your the outcome of your procedures and everything. And if you are not able to hear well, that will impact your health in the future, of course. Thank you.
Thank you very much. And I realize that we didn't do because I usually do this program in person, and therefore the conversations between the panelists are much easier. So I know this has been, what we're not used to doing. So thank you everyone for your presentations. Melissa Cruz, we're going to go right in here to the questions now. And Melissa, everyone on the screen here will be trying to answer your questions. So please go ahead with that. And if we can reserve a little time at the end, I'd like the 4 panelists just to give a few closing remarks. So if that fits in.
Okay. Well, we have got a lot of questions. And so let me start with something that I think a lot of people have asked, which is all of you guys seem to be doing great things and, really trying to accommodate and have resources and things. What is your advice for folks who are coming up against hospitals or other healthcare facilities that aren't as accommodating, who are saying, no, we can't do that, or that's not feasible, or that's too expensive? How do you recommend people approach that to try and get their health facilities to do the sorts of things that you guys are doing? And I will leave that open to whoever wants to answer.
I'll speak from OSF
Go ahead.
perspective. I think that you have to feel empowered to reach out to compliance or any of the integrity and grievance lines. These are national mandates. There's no reason any organization should be not willing to accommodate or meet some of these needs. I saw in one of the comments talking about a mask with the window is more expensive. In the scheme of things, it is not. It can be done. It's just complicated for some areas, but please reach out to your patient advocacy areas, compliance within healthcare systems. That will always get that kind of routed to the right person.
Does anyone else have other thoughts on that? Carlos, I think you were starting to say something.
Yeah, this is Carlos. Just like Patty said, reaching out to patient relations, and in case that's the name of the where we have individuals or employees who listen to any issues, and they route usually those issues to the correct people. If they're not helping, there's information out there. You can go to patient safety, risk management, and contact them, and you will hear from them. And it's going to be 100% of the time that we're going to fill the need. No, we're going to try. Every healthcare system, I believe, like I mentioned, we're here to help you. And ultimately, we are going to try our best to accommodate. Go ahead. for now. Thanks.
Does anyone else have any other comments, or I can move on to another question?
Sure. For me, because I work closely with Magnet and I work with our other Magnet program coordinators from the hospital system, we tend to go straight to our chief nursing officers and we are really advocating. So we will say, I went to a webinar, I heard this hospital system is doing this, I'm hearing great ideas. And participating, getting involved and being part of these seminars, because this is how we learn and how we take that information back. Our leadership is very good about listening for us, but we also have to advocate and champion for what it is that we are hearing that our patients want. Specifically our nurses. Our nurses will bring up excellent ideas and they will tell us this would really help with patient care. So there's just so many ways, but I would say really, really bring this to your hospital leadership.
I think truly that, Patty is our first time to have rural hospitals represented on the panel, which I was very excited because we're pretty spoiled here in this area with the big hospitals. And I realize that, and that's why, yes, you're good examples, but we needed Patty's touch to this because the reality is out there in a lot of these places where people live is that hospitals just, they're silent. They will not, I hear these awful stories and they don't know what to do until they really need to go to the state organization and file a complaint or find out what to do. So I back up exactly what Patty said here. Why don't you go on to the next one, Melissa?
I will. So another question that we've gotten a lot of feedback for is, we're talking about how folks can advocate for themselves, and certainly that's critically important. But is there any sort of training for medical professionals? How can folks make sure that, how can HLA members advocate to make sure that the hospital professionals know kind of what they need and how to help them? Is there training in medical school? Is there educating folks as they, take on positions in hospitals, in the medical field?
I'm happy to jump in here. We have recently kind of dove into a little bit of this. So annually, again, I shared that our staff goes through 2 different types of training. So we partner with compliance to then develop something associated with disabilities and awareness and there's hard of hearing, there's deaf, there are a lot of other disabilities that we need to have awareness of. But some of our local central Illinois areas, we have 2 College of Nursings associated with our medical centers, and then we also have several residency programs. So as we've done just-in-time training for our staff, that has blossomed. Like everybody else has said here, once you kind of get a little spark going. So we've had some conversations with the different residency programs on, hey, how do we bring this awareness as your physician are going through their training, et cetera. Tried to reach out to some of the College of Medicines to do this. We have a simulation center associated with our facility, and we've always kind of struggled with how do we do different scenarios with persons with disabilities, language needs, et cetera. But we recently had a conversation where we really got everyone to kind of pivot their thought. We don't need to create a scenario specific to that. Your participants need to have a disability, have a language need, and have it as part of whatever scenario that you're going through. Just interject a patient versus rewriting everything. And that really did flip the script for education and really providing those opportunities. So we specifically utilized some of our deaf population into some recent scenarios and had some great feedback, not only from the patients, but then from those that were participating. So it was physician group and then some respiratory therapists going through this. And so it was eye-opening for everyone.
Wonderful. I don't know if anyone else wants to comment on that.
Just quick
This
jump
is
in is
Carlos.
that I had the opportunity, it was asked to present, and these were students that were, it was in getting a master's degree in prosthetics. And I presented before those students, which I thought was the first time, and it was with another audiologist from Northwestern Audiology up in Evanston. And then I got an invitation to speak. It was invited by the ENT surgeons, and it happened to be Northwestern, to present before their second year students, ENT students, to present about hearing loss. And I was the only one in the room. There were two interpreters. I was the only one in the room, and there was no cart, and there was no loop. So it was quite a scary experience for me, but I think that that was a wonderful opening to see that the doctors within the hospital were opening this up and getting some training going for the students.
Great. Carlos, did you have a comment?
No, I was just going to briefly, we started a mentorship program at the university because we have a lot of healthcare providers who have disabilities, and we wanted to connect students with healthcare providers with disabilities. And we have a lot of doctors with hearing loss and with cochlear implants. Actually, in Rush, we had Rush University Medical School had Dr. Bisgrove was the first doctor to the state of Illinois to receive accommodations and to graduate from medical school with the cochlear implants. She is a primary care physician, and we have several other physicians with hearing aids and cochlear implants that help, again, mentor healthcare providers or future healthcare providers. And we're seeing more and more students feeling comfortable to self-identify with a disability, including hearing loss.
I would like to add something to that. And here, Northwestern, the Disability and Inclusion chapter also has created some guidance and guides for leaders to share with their staff and meetings or huddles, explaining how to support effective communication when there is a situation if the patient is hard of hearing or the patient's companion is deaf. So they have available information that they share with all their employees, and employees renew all the time, so they are aware of that information and they keep it in practice.
That's great. Another question that seems to be coming up frequently, and there are a lot of questions, so we will clearly not get through all of them today. So I will take them and we'll be sharing them with Elaine and our task force and see if we can get them answered and then put them up on our website. But one of the other questions that seems to be coming up a lot is for a lot of folks with hearing aids or cochlear implants, going into surgery, waking up from surgery is incredibly difficult, scary, etc., because they aren't able to hear. What are recommendations for people to do in those situations? What should they be asking for? What sort of accommodations? How should they be addressing that?
This is Carlos. Again, knowing a plan way in advance is great. We have an email, this disability_access@rush.edu. That we promote patients to send their accommodation needs to that email, and we will route it to the teams and make special notes if there's no notes in Epic in our electronic medical record. And being very, usually for surgeries too, the day before, the surgical team, the surgical nurse and anesthesiologist will contact the patient. And that's another opportunity to work out a plan of, what are we going to do at the institution, and what is the expectation of the patient too for post-surgical care. Again, is it assigning? Is it giving my hearing aids and cochlear implants to my loved one or my companion, to then right after surgery give them to the team, or the team or the area keeps those devices to then provide it to the patient once they're stable and able to have auxiliary aids on them. As we know, after coming out from surgery, usually it takes about an hour to 2 hours to come out of anesthesia, from anesthesia, and having any extra devices could also be not productive for the patient. When you're in that state, it's not pretty. That's why we ask for family members to wait about an hour to, because you don't want to see your loved ones coming out of anesthesia. But being proactive and having those discussions with the team before will help a lot for the post surgical care.
Now, just
Yeah.
type in and say, please read the article in the Hearing Life magazine that exactly explains what happened to me. And it was my daughter was my hearing advocate, and that was an agreement between my daughter and the neurosurgeon. And the surgeon did call her immediately because of problems. And fortunately, she's a veterinarian. I'm sure she saw more things about her mother than she should have ever seen, but she definitely was integral in my safety.
I would like to add something that keep in mind that you and your care team are a team. So as Carlos said and Elaine said before, communicate with them, make a plan ahead so you know what is going to happen to you after you wake up. So if you plan ahead and speak with all the people that will visit you in the pre-op area, you won't be surprised when you wake up. Because this is the worst part, being surprised when you wake up and not being able to hear. So work with your team. You guys are all a team, so work with them.
Okay, I don't think we have time for any more questions, but as I said, we did get quite a few, and so I'll work with Elaine to see if we can get those answered and get the information up on our website. I don't know if anyone wanted to make any closing remarks. I do want to thank everyone for being here and being a part of this, and Elaine for putting this all together. I want to thank our interpreters and our wonderful CART provider. And this webinar is being recorded. It will be on our website, and so you can share it with your own hospitals. We will be sending out a link to everyone who registered for the webinar, whether they participated in it today or not. We will be sending out a link so folks can watch this in the future. And Elaine, I'll turn it back over to you.
Yes, and I just would appreciate if you can send out the list of the handouts to everyone, so that they have that as separately. And if you need a sheet from me, let me know. And thank you to everyone. I really appreciate everyone on the screen here that's made this possible today.
Thank you.
Thank you.
Thank you.
Thank you.